My name is Abraham Peled. I'm a psychiatrist and a neuroscientist. And I'm trying to promote a new diagnostic approach, a new reconceptualization of mental disorders as brain disorders. Actually, the dream is that, let's assume that a resident represents a patient after the night shift. Today, the patient is being presented as a set of descriptive signs and symptoms and observations. The resident will say he's restless, he's disorganized, he's jumping from one concept to another, and he's probably suffering from loosening of associations, and so on. The dream is, and there is already enough data to suggest that the same resident can present the patient as such, saying, okay, he has these symptoms, and I think that he's suffering from disconnection dynamics spread in the cortex. And it involves the central executive networks hub, which are disconnected, and more specifically, disconnection in this case is increase in disturbance of cluster coefficient connectivity of a small world network. So the small world network is being disintegrated and unstable due to disconnections among the clustering coefficients and nearby connections. And these are related to imbalance of regulating the central hubs, in this case the prefrontal cortex, of this patient. And why is this so important? Because if you stay at the descriptive level, then you don't really have anything to suggest for the patient, and you don't really know what's going on, and you don't really know what is the strategy to help the patient and to reduce symptoms or even eliminate symptoms. But if you know this kind of formulation, it tells you where to go. You know that you're supposed to reach the central executive hubs, like the prefrontal cortex, and that you need to regulate the incoming, outgoing inputs, the degree of connectivity, in order to rebalance the whole brain connectivity dynamics that would reconnect the system and eliminate the psychotic disorganization and fragmentation. And with the upcoming technologies of brain modulation, we will have to know where to go and what to stimulate or inhibit, and we will have to have a specific etiological brain-related diagnosis for psychiatry. Because without etiology, you don't really know where to go and what to do. When you have etiology, it is a location in the body and what happened to it. In this case, the cortical systems are locations of the body, and disconnection is the pathology. Just like you say appendicitis, there is appendix is a place in the body and it is infected. So we cannot actually bypass the need, the critical need to be able to know what's wrong with the patient.